Dr. Anand, thank you so much for being with me today.
Thank you very much for giving me the opportunity. I was looking forward to it.
So today you're going to teach us how we can shop better and eat better to prevent everything from, heart disease to high cholesterol to, leaky gut, cancer. There's, so many diseases that stem from essentially what is chronic stress. And so I wanted you to share with us a little bit about your philosophy behind reducing the chances of us getting sick as we get older.
What motivated me to write this book, there are 3 reasons behind it. One, every book that I have seen, they mention in generalities that eat fruits, vegetables, beans, whole grains, and don't eat this or don't eat that. But nobody goes into specifics. Like if you are in the supermarket and you are shopping for bread, there are 10 different kinds of breads, how to choose the one that suits you. Or if you are shopping for oil, which oil to shop for and why not the others. And if you are traveling, how to choose healthy foods. You drink tea and people just squeeze the tea bag at the end, which should never be done, and why. All these have explained in this book, which no other book has done, and that was one reason. The second was that there are some chronic, debilitating, deadly diseases like heart disease, high blood pressure, stroke, dementia, cancer, leaky gut syndrome, in which there are a lot of cramps all the time after eating, and bloating, diabetes, arthritis. All these diseases, they are caused by one very simple, basic factor, and that is chronic low-grade inflammation in the body, which we don't even feel, and it goes on. And if we can control that, then those diseases can be controlled. And I have mentioned that, and that requires a healthy lifestyle. Just eating healthy diet and doing exercise, though it's very good, but that is not the whole story. You have to have a healthy lifestyle to avoid these. And healthy lifestyle requires cultivating a lifestyle which includes healthy diet, exercise regularly, and stress, which is very important these days. It's equally important factor to reduce the stress, which is a very significant cause in causing this low-grade chronic inflammation in the body. And I have mentioned in my book a technique which requires only 15 minutes, 10 to 15 minutes of practice every day, and significantly reduces inflammation, which has been scientifically proven. And the 6 things that you require for healthy lifestyle: healthy diet, regular exercise, stress reduction program, and then adequate sleep, and physically, personally, in person, socializing, not through social media, and lastly, once a year, physical checkup with the doctor. Third one that prompted me to write this book was that my wife died of cancer, and I thought to do something in her loving memory, so I wrote this book, and all the proceeds of the book will go directly from Amazon to Dana-Farber Cancer Institute in Boston.
It is called The Healthy Diet and Mindfulness to Prevent Coronary Heart Disease. So in the beginning, you talked about how we don't know how to shop properly. We have so many different choices in the supermarket. So what are some of the main things that we should be looking for when we're shopping, and what should we absolutely avoid?
What you should absolutely avoid is fried food, highly processed meat like sausages, bologna, salami, bacon, and prepackaged snacks, which are also fried snacks. And you should avoid sugar, and you should avoid saturated fats, trans fats, and oils. Saturated fats are present in foods like meat. Make sure it is small pieces of meat, fat trimmed off. There are trans fats like margarine, Crisco, where they take vegetable oil and solidify it and it becomes margarine. So that is trans fats. Oils should be avoided as much as possible because they cause this inflammation. And the only oil, if you do use oil, is avocado oil. Other oils, like famous ones are canola oil and olive oil, other than avocado oil. Canola oil is made in Canada, and they claim it has a lot of omega-3 fatty acids, and that is the reason why it is used all over the world. But first of all, during extraction, all the omega-3 fatty acids die. Now, as far as olive oil is concerned, when you buy oil for cooking, the first thing to consider is the smoke point. At what point the oil will smoke. If you heat it up more than that, it converts into trans fats, which are again harmful. The smoke point of olive oil is 320 degrees Fahrenheit, and we do all our cooking around 400 degrees Fahrenheit. So there is some smoke point element in it, and a lot of trans fats are formed. Secondly, there is Professor Vogel, Vogel, and he demonstrated in his young medical students, if you have oil and you put bread in it and you eat, or put oil in the salad and you eat the salad, in about less than an hour, your arteries constrict by about 31%, and it takes almost 10 hours before they come back to normal. During constriction, damage is caused to the inner lining of the arteries, and then we don't wait for 10 hours for the next meal. We eat every 4 or 5 hours, if not more frequently. So they remain constricted all the time, and that leads to damage and then coronary artery disease. Then he found out how come in Mediterranean countries they eat a lot, and it's considered to be a good diet. So he thought of that they use balsamic vinegar with the oil. So then next time in the salad, he put oil and balsamic vinegar, and the arteries did not constrict. So he said, oh, balsamic vinegar has antioxidants in it, maybe that is the reason. So if you are going to use olive oil, only use in the salad and always put balsamic vinegar, but never in cooking because of the smoke point involved.
Is it only balsamic vinegar, or you can use any vinegar?
Only balsamic, because that is the one which has antioxidants in it, not the white vinegar.
Is there anything else that you think that we should really keep in mind as we are shopping for our weekly,
yes.
Foods?
There are good carbs and there are bad carbs, there are good fats and there are bad fats. You should eat good carbs and good fats, avoid bad carbs and bad fats. Good carbs are fruits, vegetables, beans, whole grains, whereas the bad carbs are sugar, white flour, cornstarch and cornmeal. Rice, white rice, is a bad carb in that sense, but we never eat rice alone. We always eat it with the beans, and beans have a lot of fiber. So when you combine them and eat, while chewing, all that fiber of the beans gets thoroughly mixed with the rice, and then rice acts as a whole grain. Then the bad fats are saturated fats, trans fats, and oils, which I have already mentioned. And the good fats are nuts, seeds, fish, and avocado, fruit. But avocado has good fat in it, which contains twice the calories of the carbohydrates. Therefore, make sure when you eat avocado, don't eat more than 2 tablespoons at one time and no more than twice a day. And as far as nuts are concerned, all nuts are not created equal. The 2 nuts that are highly recommended are walnuts and pistachios. Other nuts contain saturated fats. And therefore, always have these nuts. That always remember, if you are a vegetarian, take 1 multivitamin with mineral every day, because vitamin B12, which is very important, comes only from animal source. And otherwise, everybody should eat as much of antioxidants as possible. And antioxidants are present in nuts, seeds, and they are present in spices like cinnamon, turmeric, garlic, ginger, so these spices. And then in tea or coffee, Americans get their antioxidants in the morning from coffee. They are present in red wine, and lastly, chocolates. And I'm not depriving anybody of dessert. I avoid everyone to avoid desserts. I do too. But every night after my dinner, I have half an ounce of dark chocolate. Make sure to read the label that it says a cacao content of 70% or more. If it is less than 70, do not buy it. That is not effective.